Hard to believe. Just 2 short years ago, we didn't really know what COVID-19 meant. In fact, it wasn't really a phrase that was used at all. The World Health Organization officially named the coronavirus on February 11th, 2020. Since then, a lot has changed, including our health habits. Americans are sitting more now, and we're walking less. News 5's Nadine Abusada shows us how that can impact our heart health.
While people try to find normalcy, the effects of the pandemic still linger.
The pandemic has dragged on in most people's eyes.
Lingering so long, it has affected the heart.
Anecdotally, patients were experiencing certain cardiovascular symptoms that could be related to this ongoing pandemic.
According to a Cleveland Clinic survey, 40% of Americans have experienced one of the following heart issues since the beginning of the pandemic: shortness of breath, dizziness, increased blood pressure, and chest pain. There are many reasons this is happening, but they all started with daily changes made in the past 2 years.
Things like not being as active, so maybe not going to the gym, sitting more at home, not doing that walk to work.
Factors include too much sitting, mental health problems, and changes to diets, with 65% of Americans saying they're stressed more.
Chronically, we know stress causes us to make the wrong dietary choices. Grab that chocolate rather than the banana, for example.
Then there are people who delayed doctor visits because they were scared of catching COVID. Finally,
with COVID, I got it fairly mild. I think I wasn't too sick.
Those who caught the virus itself.
About a month ago, I had this thing where my heart, it just started racing and pounding. And I ended up going to the hospital one day because I was so dizzy and I thought I was having a heart attack.
It's estimated 1 in 4 Americans have faced heart conditions after catching COVID. Cheyenne Wilkes had the virus back in September. Then a month ago, she went to the doctor for heart issues. They told the 27-year-old she was suffering from hypertension.
It's terrifying. I was healthy before this, and now I have to worry about my heart giving out.
She's not alone.
I still have some lingering things that are still here with me.
Ivanka Hall didn't have any heart problems before getting the virus.
The breathing, having a difficult time breathing, which was like one of the first things that I knew that I had COVID last year.
She had COVID exactly a year ago. Along with shortness of breath, she still deals with chills and brain fog.
I think part of it is fearful. Like if I'm still having these issues, what are the other things that are going on with COVID? What has COVID damaged internally?
Dr. Laffin says while there is a current focus on COVID, it's important not to lose sight of the other risks as well.
COVID's not good. We all want it to go away. We all know that we don't want to catch it, but we can't ignore our chronic risk factors for cardiovascular disease. That's still more likely to kill you than COVID.
Reporting in Cleveland, Nadine Abusada, News 5.
Thanks, Nadine. And things that help include exercise, a good diet, and regular checkups.